My name is Mercy Chiazo. I'll be talking on one of the eye diseases called retinal detachment, its types, symptoms, and possible treatments. Retinal detachment, as my topic implies, is a serious eye condition that happens when your retina, that is a layer of tissue at the back of your eye that processes light, pulls away from the tissue around it. Doctors call it detached retina. Retina could tear before it detaches. A torn retina usually has the same symptoms as a detached one. If your retina gets torn, the fluid inside the eye can leak underneath and separate the retina from its underlying tissue. That is retinal detachment. Now, what are the symptoms of retinal detachment? A retinal detachment doesn't hurt. It can happen with no warning. You might notice 1. Flashes of light. 2. Lots of new floaters, that is small flecks or thread in your vision. You can also notice darkness or a curtain over your vision, including the middle or the sides. Now, there are 3 types of retinal detachment. One of it is rheumatogenic retinal detachment. This is the most common kind of retinal detachment. It happens because of a retinal tear. It can also happen due to age. It can also happen when the various gel that fills your eyeball pulls away from your retina. It can also happen because of an eye injury, surgery, or nearsightedness. 2. We have tractional retinal detachment. This detachment happens when scar tissue pulls on your retina, usually because of diabetes has damaged the blood vessel in the back of the eye. 3. We have exudative retinal detachment. This happens when fluid builds up behind your retina, but there is no tear in this type of retinal detachment. The fluid pushes your retina away from the tissue behind it. The common causes may include leaking blood vessels and swelling because of conditions such as an injury, an inflammation, or age-related macular degeneration. Now, what am I going to use as my target audience? I can use people over the age of 50. I can use people with previous retinal detachment in one eye, people with family history of retinal detachment, people with extreme nearsightedness, that is extreme myopia, people with previous eye surgery such as cataract removal, people with previous severe eye injury. Now, what are the risk factors of retinal detachment? One may likely have a detached retina as one gets older. If you have severe nearsightedness, if you have an eye injury or cataract surgery, if you have a family history of retinal detachment, if you have lattice degeneration, that is thinning along the edges of your retina, if you have diabetic retinopathy, that is damaged blood vessels in the retina because of diabetes, if you have posterior vitreous detachment, that is the vitreous gel in the eye pulls away from the retina, you may more likely have a detached retinal detachment. Now, what are the possible treatments? Treatment may involve one or more of these procedures. 1. Laser thermal or freezing cryopathy. Both methods can repair a tear if it's diagnosed early enough. They are often done in a doctor's office. 2. Pneumatic retinopathy. This works well for a tear that is small and easy to close. The doctor ingests a tiny gas bubble into your vitreous gel. It presses against the upper part of your retina, closing the tear. 3. Scleral buckle. In this type of procedure, the doctor sews a silicone band called buckle around the white of the eye. This white of the eye is called the sclera. This pushes it towards the tear or detachment until it heals. This band is invisible and is permanently attached. The reason why the doctor puts this silicone band is to strengthen the vitreous band. 4, we have vitrectomy, which is a surgery. This surgery repairs large tears or detachments. In it, the doctor removes the vitreal gel and replaces it with a gas bubble or oil. In my conclusion, I will advise to go to an eye doctor right away if you see new floaters, new flashing lights, or any other changes in your vision. An eye exam can also flag early changes that you may not have noticed. Treatment could prevent problems down the road. Get your eye checked once a year or more often if you have conditions like diabetes or if you are very nearsighted. Thank you.